What are CFS biomarkers? What exactly are biomarkers for myalgic encephalomyelitis and chronic fatigue syndrome? These biomarkers are measurable biological indicators that help identify or characterize this complex illness. CFS is primarily diagnosed through clinical symptoms, such as severe, unexplained fatigue and various systemic manifestations. The goal of identifying biomarkers is to provide objective evidence that can support diagnosis, assess disease severity, and potentially guide treatment. However, it is important to note that no single biomarker has been universally accepted for clinical use. Researchers are currently exploring several potential biomarkers for CFS. One area of focus is autoantibodies against receptors. Elevated levels of autoantibodies targeting beta to adrenergic receptors and muscarinic acetylcholine receptors have been found in some patients. These autoantibodies may contribute to the autonomic nervous system dysfunction often observed in CFS and could serve as potential diagnostic markers, correlating with disease severity in certain studies. Another area of research involves viral markers. The presence of human herpes virus 6 DNA and related markers in the blood has been associated with the severity of CFS. This suggests that viral reactivation or persistence may play a role in some patients' experiences. Inflammation and endothelial dysfunction biomarkers are also being studied. Circulating molecules that reflected systemic inflammation and dysfunction of blood vessel linings have been linked to CFS symptoms and severity. These findings overlap with conditions such as long COVID, indicating a broader context for understanding these illnesses. Additionally, researchers are looking into metabolic and biochemical abnormalities. Studies have identified mitochondrial dysfunction affecting energy production, which may impair cellular metabolism and immune regulation. Changes in biochemical pathways and cellular chemical composition have also been detected through advanced techniques. Electrophysiological markers are another promising area. Dysfunction of ion channels, including those for acetylcholine and transient receptor potential, has been observed in CFS patients. This dysfunction may underlie some neurological and autonomic symptoms experienced by individuals. Recent studies have also explored composite biomarker panels. By combining multiple blood markers and clinical data into mathematical models, researchers have been able to distinguish CFS patients from healthy controls with reasonable accuracy. This offers hope for future diagnostic tools. Despite these advances, it is crucial to understand that no single biomarker or test is currently validated for routine clinical diagnosis of CFS. The disease's complexity and overlap with other conditions make biomarker development challenging. Ongoing research aims to validate these findings and improve the sensitivity and specificity of tests while ensuring they are accessible and cost-effective. In practical terms, while these biomarkers hold promise for understanding the pathophysiology of CFS and aiding diagnosis in research settings, diagnosis still primarily relies on clinical evaluation by healthcare professionals. This approach supports the understanding of CFS as a biological illness involving immune, metabolic, and neurological dysfunction rather than solely a psychological condition. Patients and clinicians are encouraged to follow established diagnostic criteria and seek personalized medical advice.